Okay, this short video clip looks at some of the basic examination procedures for upper cervical flexion. So, with light tactile cueing, assist the patient into active upper cervical flexion. So continue with that movement, please, Hannah. As the patient's making that movement, we want to chat with them. Does that feel painful? Does that feel restricted or tight to you? If the patient says painful, make sure that you clarify where she's experiencing pain as she executes that movement. If it feels tight or stiff to her, again, clarify where exactly is she feeling any pulling, tugging, tightness, stiffness. Okay? So perform that movement one more time. Bring your chin down and in. Okay? Let's do a very gentle overpressure, which is additional passive movement at the end of her available active movement. Again, if that causes discomfort, the overpressure test, clarify exactly where the patient had pain. If you want to study this movement a bit more, if the movement appeared restricted, the patient was unable to actively move their upper cervical region into flexion, we can study movement at the C0, C1 level by testing whether or not the mastoid process, which is located right below the earlobe, moves in a posterior direction during passive upper cervical flexion. If the bony mastoid process is moving in a posterior direction, we can likely assume that the occipital condyles are roll gliding in a posterior direction for upper cervical flexion at the C0, C1 level. If we wanted to test for movement limitation at the C1, C2 level, find the bilateral lamina of C2, and then we'll just move our index finger up just a little bit so that we're between the posterior arch of C1 on the right and the lamina of C2 on the right. At this point, we passively flex the upper cervical region and we feel for whether or not there's additional tissue tension at this level as a result of this passive movement. If we're unable to feel movement recruited into that level and the tissue does not become more tense, we can make the assumption that potentially there's movement restriction in the direction of flexion at the C1, C2 level.